Good evening, guys. Welcome to our video today. Today we have a very special feature we are going to talk about, and we are going to talk matters sickle cell anemia. I don't know if you ever heard of sickle cell anemia. Welcome to the video, and kindly if you have not subscribed, I welcome you to subscribe to our channel, and also get us a nice comment down below. The channel is Future Talks. Welcome to our channel today. And the video is going to talk about sickle cell anemia. We're going to talk about sickle cell crisis. We're going to talk about signs and symptoms. How do you know someone has sickle cell anemia? And how do you manage, or what do you do when you are in such kind of a crisis? How do you manage the sickle cell anemia? So guys, welcome. I'm going to make it in very simple terms and also in very simple kind of presentation, so that we get to know what really happens with this condition called sickle cell anemia. Welcome guys. Welcome guys. I don't know if you have ever heard of sickle cell anemia. It's a very common condition, and when you see us with this gadget here, this is called a stethoscope, and this is the type of stethoscope I normally use. It's one of the best quality of this. It's called MDF Medfit Med Friend. Yeah, I don't know which is your type there. It is normally this instrument we see it with doctors and also nurses, mostly where we practice. If you've ever gone to see a doctor or you've seen your nurse there, they use this instrument to check on you, especially to check on your breath sounds and also check on your heart, how it is working. It is called a stethoscope. Yeah, stethoscope. I'm going to attach the name here so that you get to see stethoscope here. This is the instrument which we normally is used in the hospital setting to check on the condition of your patient, especially for the lung sounds and also the heart sounds. It checks the heart and also checks on how one is breathing. So very important, a very common instrument, but very vital in the practice of seeing the patients, because I'm told long time ago the way doctors used to examine the patient used to be very awkward. You can read how the stethoscope was discovered. I was reading that today, and also it's amazing how the medical field has really changed to get the comfort of getting to see the patient the best way possible and also help our patient the way they are supposed to be helped. So guys, welcome to our video. The channel is Future Talks. Today we are going to talk about sickle cell anemia. We are going to talk about the sickle cell crisis, signs and symptoms, and also share some information of sickle cell anemia. It is a very common condition, but not really well known to many. Normally, when we talk about sickle cell, we know a sickle is something which is like a moon. It looks like a moon. It goes like this, yeah, like this one here. So that is a sickle. Sickle means like a crescent or like a moon. Uh, the sickle cell cell means these are the main components which make our bodies, and mainly when we talk about sickle cell, we're talking about the red blood cells. And red blood cells, normally they are spherical in nature, they are round in nature, and the specific way they are made, they are in such a structure that the normal red blood cells are made in spherical way, so that the main function of these blood cells is to carry blood, oxygen in our blood system, which also that blood through the blood system, that those red blood cells, they carry oxygen to the main vital organs, Kindly, if you don't know about the vital organs, see our previous video. We are talking about the vital organs and how they function, especially with the drugs. So, on the red blood cells carry oxygen to the various parts of the body, especially to a vital function in the brain where they take oxygen, because our brains love oxygen, and also they love that blood supply to the main component in our brains here in the head, which really helps in various activities, and also because the brain is the main engine which coordinates the activities of the body. And also the heart and also the other organs like the lungs, also they have their function in these red blood cells and how they function. But mainly I want to focus about the red blood cells and the sickle cell anemia. So sickle cell anemia is an hereditary syndrome, or is inherited, or it is gotten from the parents to the offspring, the child. For those parents who have a gene called which is called S. Actually, the patients or the people who have sickle cell anemia have a special kind of hemoglobin. Hemoglobin is the component which carries the blood, which is called HbS. HbS, that is, they carry the S factor in their genes, which now affects now their body functions, and they're considered to be sickle cell. So when the genetic study is done on these patients, they find that they carry what is called the hemoglobin S. And normally they don't carry the normal kind of white red blood cells, but they carry the spherical ones. So this condition called sickle cell anemia is majorly inherited from the parents to their kids, especially when the parents are the carriers of this gene called HbS, which now changes on how the functioning and also how the body functions. So in short, we're going to see how this HbS and the normal Hb work. But normally, how you know that someone is having this sickle cell anemia? Sometimes it is difficult, especially in young babies, especially in Africa, unless in advanced kind of setting like where we have now the advanced hospitals, the likes of Aga Khan, Nairobi Hospital, and others who have come on board. They're checking on this HbS, which is to detect the sickle cell. Sometimes it's not very easy. And when you get that a baby is born, you get that this baby normally behaves normal till 6 months, because the baby has now what we call the mother's blood. The mother's HB is working on the baby very well. The baby starts to have the problems after like 6 months post delivery. So what are the signs and symptoms of this sickle cell anemia in a patient? The most common kind of thing you see in this kind of patients is painful crisis. What we call crisis is one of the things which can be seen on this the kind of patients, which can be either mild or severe, and may really affect the way this can be very painful for these patients, and it leads to a lot of pain. So when they present to medical area, and also the patient should be taught, if you are one of those victims of this kind of condition, you when in pain, you are put on special kind of drugs which really can reduce that pain. Another thing you find in this kind of patients is severe anemia. And severe anemia, most of the time, it comes up with fatigue. That means somebody gets tired very easily. They may have some dizziness. They may have also shortness of breath. And also, When we have this severe anemia, we have also the patients on the lungs now. We have the breathing system, the lungs are really affected, and the patient may have some difficulty in breathing. They may have symptoms like asthma. They may have something like when they sleep, their sleep pattern, and also what we call sleep apnea. They have gaps between the or breathing between in their sleeping, and also they may have what we call acute chest pain, which can be really life threatening. It may present like pneumonia. That patient may be coughing a lot, and also they may have fever and also pain at some point. And also to some extent, the patient may develop a stroke at some point, and also they may have what in the eyes, what we call jaundice. That's the yellowing of the eye because of the breaking down of those red blood cells in the body, which may lead to other problems like the ones I've mentioned. So the best advice for such kind of patients who have sickle cell anemia, they are really advised on adequate hydration, that you take a lot of water so that it makes what sickle cell hates in the body is the body which is dry and is not well hydrated. So either when the patient is at home, is advised to take a lot of water, and in an hospital setting, the patient is normally put on hydration, especially with the normal saline as prescribed by the doctor there, so that the patient gets to relieve that kind of pain. The patient is also put on what we call hydroxyurea. Hydroxyurea normally it assists in the formation of the normal red blood cells. From what I've said is that these patients who are with the sickle cell anemia, normally they have abnormal sickle kind of red blood cells. So hydroxyurea is used for those patients so that they try to make kind of normal red blood cells in their body. So it is a lifetime drug called hydroxyurea, which is commonly used for those patients who have this sickle cell disease. The patient is also given other even antibiotics, especially the penicillins are the best drugs for those patients, because sometimes you get that the infection level also goes to another level. So these patients are put on these kind of antibiotics to prevent any kind of problems with infection, because into problems. Another thing which is given to the patients is folic acid or folate, which also supplements folate or folic acid is very important in improving the HB by the formation of the red blood cells. So another thing which is very important for those patients is also getting a vaccine, especially against flu, because flus are very common with this kind of patients, and we don't want to get them into that level. So also, if the patient is anemic, we transfuse or we get blood too. We transfuse the blood. So blood transfusion is part of the main management for these patients, because if you check the blood levels at that point, they can be very low. So another thing which is done is bone marrow transplant. Very expensive, yes, especially in Africa. Most of the people don't get to that level, but part of the management of this is bone marrow transplant, which is done to help these patients produce the normal kind of HB, the hemoglobin, and also the RBCs, which can assist the body in improving and also in becoming. We're talking matters sickle cell anemia. And the signs and symptoms, in summary, I'm going to talk about what are the signs and symptoms of this sickle cell anemia. Oh, the obvious one is anemia, because of the production of abnormal red blood cells. So the blood level is really affected, because we have abnormal production of this kind of uh, red blood cells, which really reduce on the amount of red blood cells in the system. And like I have said, red blood cells are very important in the transportation of oxygen and other things in the body, which make our body function normally. So in sickle cell anemia, patients normally present with anemia as one of the things. The other thing is pain, especially episodes of pain which come on. That means they come on and off. So, and there is it's a very severe pain, they call it. So this may require this pain may also require hospital stay at some point. So the painful crisis is normally managed in the hospital setting with very strong kind of painkillers. Another thing you may have is the swelling of especially the hands, where the patient has some swellings of the hands, and also getting some problems with the pain on the extremities, the hands, and also the and the feet, because of the abnormal breakdown of the red blood cells at those areas. So the patient may present with those painful kind of crises. And also the patient, also because the immunity level is affected, the patient may come with a lot of body infections. Like if you do complete blood counts, CBC, in other countries they call them whole blood count, you will find that the white blood cells are really high, showing signs of infections. So also that's a sign that you may find abnormal kind of readings from the complete blood count, which are very extreme, unlike how the patient is presenting. So that one can alert you that the patient may be having sickle cell anemia if the bone marrow aspirate has not been done and really determined if the patient has this sickle cell anemia. So the patient may also have delayed puberty or growth, because also the shortage of red blood cells can slow the growth in infants and also children, and also delay the puberty. So the milestones of the child or the person may be affected. That's also can be a notifier that something is not right about the patient. We may also have patients with the vision problems, because also we have small veins in the eyes which supply the blood to the eyes. So because of the breakage of those red blood cells, and since we found they are sickle they are sickle in shape, and also they are very sticky, so they block the blood to the eyes. So the patient may be complaining, or the person may be complaining of the vision problems. So that is one of the things which can also show you about the problem, or may alert you on this thing about the sickle cell anemia. So as an health worker, so pain is very important. You manage it very well. Hydration, getting more water to the patient as much as possible, but also you watch for fluid overload as appropriate for the patient, to make the patient as comfortable as possible. Also monitor the SpO2 and also the oxygen saturation for the patient, so that you ensure the patient is really breathing in the right way. And also the patient should be ensure that the patient is on the best the regular medication. I talked about folic acid and hydroxyurea, which will assist in at least for the production of the normal kind of drugs, which of the red blood cells, which can help the body function at least normally, because we want to make the patient as much as possible. So the patient may complicate and develop the complications of this anemia, sickle cell anemia. The patient may develop a stroke, because of the kind of these red blood cells, they block the supply to the brain, and also so the patient may develop what we call stroke, because of the denying of because we found out that the red blood cells, they assist in the supply of oxygen to the brain, and the brain loves oxygen. So when it misses to get to the proper site of the brain, so that the patient may present with the stroke symptoms. Another thing we may have is what we call, as a complication of sickle cell anemia, is having what we call rhiapism. Rhiapism is a painful kind of penile erection, especially where a patient presents with an erection which doesn't go down, but which is very painful. So we have abnormal kind of supply of blood to the vital penile area. So uh, the normal control of that organ is not there. So the patient presents with a lot of pain, and also what we call rhiapism. The patient may develop a blindness because of the, also, as I explained, the supply of the eyes is really affected, and if the blockage and the breaking down of those small vessels in the eyes gets affected, the patient also may develop eye damage. Or other organs also may be damaged because of these kind of cells. So, and also the white organs which need really blood supply, they really get affected. That includes the heart, the lungs, the kidneys, and also the brain. They get damaged through this because of the condition and also the physiology of this sickle cell anemia. And also the patient may develop what we call deep vein thrombosis, where you find, if you touch like down at the thigh of the patient, uh, the veins at the thighs down there, they get occluded because of the poor movement of blood there, because of the abnormal red blood cells. So the patient developed deep vein thrombosis, which may also lead to a thrombi. That means a blood clot forms there, and also which can be occluded, can come up to the brain, also go to the heart, and also cause a lot of problems. So sometimes these patients can present with this kind of deep vein thrombosis, and also it may be they may present with, also because of the complications of the deep vein thrombosis, they may cause leg ulcers because of the kind of because the blood, the red blood cells, the abnormal sickle of the red blood cells, they stick together, and the normal movement of blood is affected really in the body. So the patient may present also with the leg ulcers. So it is very important for the healthcare worker to give differentials, because these things I've mentioned may be caused with other factors. So the proper diagnosis should be done, and also maybe from the gene studies, also find out from the parents what is happening. Proper history should be taken from the family to find family history, so that these patients can get to be managed very well. So about the lifespan of those people with sickle cell anemia, it depends. According to my study, it depends from one country to another one, but normally they say 35 to 40. There are those people who do up to 50 also, depending on the latest kind of studies which have been done. But it's really more affects the more black people than the white people. And also it affects the Asian people also. So it's a very kind of common kind of condition. So on prevention, the thing is, on preventing this, because this thing is genetical, it is always good to do premarital counseling, and also premarital genealogy study. That's where you find out if there is any family history of this sickle cell disease in the family, and who had it. And also my parents can check before they give birth to those kids. They can do gene studies where they can find out if they are the carriers, because if the people are carriers and they carry this S gene, they don't display the sign, the sickle cell disease symptoms, but their offsprings, when they give birth, if the father and the mother have this S gene in their hemoglobin, it really affects now the kids, and the kids will present with such kind of condition, and also which may affect on how these kids operate. So gene study and also marital counseling on the genealogy of the family is very important, so that when one gets into getting the kids, can know how to take care of them at that point, and also know how to manage themselves with that kind of condition, because the condition is not preventable unless attacked at the point of the parent level, so that a proper decision, informed decision is made at that level. Thank you guys on watching this on sickle cell anemia. Kindly, if you have not subscribed, subscribe to our channel, and let me know from the feedback down below on our video today, and also let me know on what you want to watch on this channel, so that we make our channel better. We are in the road to 10,000 subscribers, and I want to welcome you, and also welcome to our next video. Thank you guys, and peace.